My name is Dr. Faith Mushira. I'm a medical officer. I work at Fertility Point, Kenya. So Fertility Point is located in 40 suites. It's 40 suites, the building along Hospital Road in Upper Hill, Nairobi. So at the moment we're in Bungoma, we are doing a fertility camp here, but the plan is to go in different parts of the country so that we can educate the public about fertility issues and the fact that there are solutions that can be offered for couples who are struggling to conceive. So infertility by diagnosis is inability of a couple to conceive. That is after 1 year of regular unprotected intercourse. That's why we define it as infertility if the period has exceeded 1 year. So infertility can be caused by, could be either male or female, and we find that both male and female infertility contribute equally to the cause of infertility. So for the cases of patients we see, we find 30% of cases are male infertility, 30% of cases are female infertility, and then there are cases whereby it is a mixture of both, where there is male and female infertility also contributing to about 30%. Then there are other cases what we define as unexplained infertility, whereby we have done routine tests for the male and the female, and we are not able to find any specific cause of the infertility. So Fertility Point has been ongoing for about 3.5 years. So the reason behind the inception would be because we realized that there was need for fertility treatment, especially specialized fertility treatment. Yeah. So we are having quite a huge population of the world is infertile, almost 20%. So it means patient will need services in places whereby even if they are not able to conceive naturally, there are other ways of conceiving that can be done, and that will require a more specialized form of treatment. So it is more of a subspecialized hospital that deals with fertility issues. Yes. Why Bungoma? Even from the cases we have seen, there is also the cases of especially male infertility is on the rise. Not just in Bungoma, but even elsewhere. So yes, we have started with Bungoma, but we would actually want to hold these camps in different parts of the country. So when we look at the causes of the male and female infertility, I would start say with female infertility. The most common cause of female infertility is actually ovarian issues. So we find that people have been trying to conceive for too long. They have not been seeking the right services. So they have been going maybe to the herbal doctors, they have been going to other clinics. So by the time they are coming, they are past the age of 40 and their ovarian reserve has decreased. So ovarian factor is one of the most common causes of female infertility, especially in our setting, whereby we usually say the reserve of the eggs have gone low, so it becomes very difficult to conceive naturally. Another major factor is a tubal factor. There's an increased tubal factor, especially if someone has had a sexually transmitted infection before, and those infections could cause blockage of tubes. So that is when it comes to the female infertility. For the male infertility, most commonly the diagnosis is usually either when we do a semen analysis. The semen analysis is a basic test that we usually do for cases where a man has been trying to get a lady pregnant and it's not happening. And most cases we find that either they have a low count of sperm or it may be low motility meaning how fast the sperm is moving. So when we come to try and find the exact cause of those, the low count or low motility, in most cases you're not able to find an exact cause, but you're able to treat the particular condition. Treatment for infertility can't be helped. There's so much you can do with it. One, it could just involve just counseling the couple. Maybe they have been trying at a particular, because for pregnancy to occur and you're trying naturally, you have to meet with the woman at a particular time during your ovulation cycle. So you find that people are not, the patient may not be informed of that. So we are able to advise them and tell them this is the best time for when you should try. Then other treatment could even just be simple medical treatments. Maybe someone is just having issues with ovulation. There's some treatment that can be given to to enhance that process. Yeah. Other things that we are able to do at our center is something called insemination, especially when it comes to the male factor infertility. So if a male partner has a low count or low motility, we are able to do a procedure that would help to increase the motility and the concentration of those sperms and increase the chances of conceiving. That is what the insemination is about. Then in other cases, especially for ladies with blocked tubes, and the ones I'm talking about where the reserve of the eggs is low, or maybe for the male partner the sperm is too low, we are also able to do other assisted form of reproduction, that is in vitro fertilization. Of course, it would be advisable for both partners to come, so the male and the female, given that we said both could contribute equally to the cause of the infertility. So that would be the ideal situation. But you know, our setting, maybe the man does not want to come, the lady wants to come first, we can still evaluate each of them separately. So whoever comes, you just manage the person who came to see you at that particular point. And then eventually, you'll have a discussion where it involves both couples so that they can understand this has to be done by both of them eventually. So during that stage, I don't know, sometimes our African men do not want to come and get tests done. They do not want to show up when they are needed maybe for a particular treatment. So those are some of the challenges, but to tell you the truth, I think they are coming up more often. Most common misconception about infertility would be, I would say, the fact that quite a number of people think that female factor is the largest contributing factor to infertility. So that is not the case. It is actually, like I said, an equal contributing factor. So I would say let's all come up, male, female, find what is the issue is, and that it could save most marriages actually. The diagnosis is made early and treatment is also started early. So most cases in infertility treatment are actually outstanding. The reason being, most of these couples have struggled for so long to get pregnant, yeah? So it's been a long journey for them. They have gone through so much, they have gone through so many, maybe even in different relationships here and there. And I would say what case stands out for me, mostly I would say for men who have, there's a condition we usually refer to as azoospermia, whereby there are no sperms. With the semen analysis, it shows there are no sperms in the semen. So most of those men have been told there's nothing that can be done, you're impotent, you can't be helped. But you find that these couples are able to come to our center and we can offer them solution that can actually finally give them a baby using the sperm from the man. I would say the uptake is getting better. People are coming up more. People are becoming more informed. We are not yet there. There are countries that are already doing this treatment for much longer. Other developed countries, other developed nations, of course, the uptake is a bit higher. People are not scared that I got a baby through IVF, or they are not ashamed of that, yeah? So there's still stigma in our society. People are not able to discuss that they did other assisted form of reproduction to get their baby. So I'm hoping we can also get there and find that infertility is just like any other disease that needs treatment, and these treatments are available, and we should be able to have an open discussion about it. If there's a problem and there's a solution, then why not? I would say the fact that most fertility treatments involves the patient have to be out of pocket. They have to pay cash for most of the services. Yeah. So if at all more insurances can come on board to take up the management of patients who are seeking fertility treatments. I would say infertility is a disease in our society. We should not stigmatize people who have infertility illnesses. There are solutions for them. The earlier they are able to seek treatment, the higher the chances of even getting a pregnancy. So if you know someone who has an issue with fertility, then I would just tell them their solutions. Show them some love, show them that you understand the situation. Do not keep asking them, when are you getting a baby? You should actually more advise them, there's a hospital, there's this fertility point in Nairobi where you can go and seek treatment.